I'm actually a physiotherapist by background, but I stopped working clinically some years ago when I went into administration, which also coincided with my hands giving up. For those of you who are physios, you know the problems we have with our hands. I run a company, I'm the CEO of a company called the Independent Living Centre of New South Wales, and we provide advice and information on assistive technologies in the home environment. So I'm going to talk about that today. For those of you who don't know, I had an interesting journey here this morning. I left my hotel at KLIA, having booked a taxi for UKM with the address 2 days ago. We went to the main campus first. So I think I've been everywhere. Just to let you know too, I love coming to Malaysia. I come to Malaysia quite often. My daughter-in-law is Malay, and she and my son live in Canberra, but her family come from Alistair, and so I go there quite regularly. I'm often here in Malaysia coming to weddings and hantaran and all those things that you do with families. So I do enjoy being here, and I'm really pleased to be here to talk to you today. So I'll just start this. So I know our model is very different. The model that we run in every state in Australia isn't replicated anywhere else in Asia, and there are some services that are quite similar but not exactly replicated. Please ask questions along the way, and if I can't see you, I'm sorry. So we're an information service, and the Australian service delivery framework in both ageing and disability are undergoing immense reform, and part of that reform, which I'll go through again a bit later, is about empowerment and choice. And in order for people to be empowered to make choices, they need information. You can't make a choice unless you have information. So here we are. This is just the opening slide. We exist in Blacktown, which for those of you who've been to Sydney, is in the geographic centre of Sydney. Sydney's a very, very large geographic area, even though our population is much smaller. And it's a long way from, even though it's the heart of Sydney, it's a long way from my home. We're an NGO, a public company NGO, and registered charity funded by government. Our vision is endless possibilities for all. We believe that if people have access to the assistive technologies and the environments that meet their needs, they have a chance of doing whatever they would like to do, lead the life of their own choosing. And our purpose is to provide impartial advice, information and leadership on assistive technology. We also include the environment in that builds on possibilities for choice. The word impartial comes up quite a lot in the way we operate our service. I'll explain that a bit further along. The values that drive our company are leadership, choice, community and impartiality. So we provide leadership in thought leadership, so the government relies on us for policy advice, program structure advice and advice on emerging technologies. Choice, people need to have choices to lead their lives. We stay connected to our communities, and there's that impartiality again. Being impartial and providing commercially unbiased information is really important to our model of service delivery, and it's enshrined in our funding contracts as well. And yesterday I was lecturing at Nanyang in Singapore to students, so I used the analogy of, if you want to go and buy a car and you go to the local Mazda dealer and you say to the Mazda dealer, I need a car and these are the features that I need and these are the needs I have, my mobility needs that lead me to buy a car. He's not going to tell you that the best car for you is at the Honda dealer. He's going to approximate your needs with his vehicle because his fundamental thing is selling. It's the same in assistive technologies. Even if, as in Australia, the suppliers hire therapists to help consumers make a choice, their fundamental thing is they have to sell their equipment. They have sales targets to meet and budgets to meet. So the advice they give a client is not going to be impartial. That's our role. We don't sell anything. We have no commercial arrangements with suppliers. They give us whatever we need, including items for our display, and we do not charge them to be in our considerable database, which I'm actually going to show you later. So this is the definition we use, and it's the ISO 9999 definition, expanded marginally, and the English has been changed a little bit so that it suits the Australian community, because you will all know, being here in Malaysia, that the Australian version of English is marginally different to the English version of English and the American version of English. Sometimes we actually don't understand each other. This is what we believe. Person-centred approach has the individual at the centre. This is part of the new reform process. And at the ILC we believe that for people to lead a life of choice, there are 3 foundation blocks that need to be in place and need to work together. And they are a barrier-free environment in their personal spaces, so their home, their work site, wherever it is they need to operate. Their assistive technology products, so all the equipment that they need needs to work for them in those environments, and then whatever personal assistance they need on top of that. For all of that to work, there needs to be a system of support that's about the public environment. There's no point in somebody leaving their house in the morning, getting on the bus and heading into the city to go to the bank if there are steps leading up into the bank. Their whole day falls apart. The policy, legislative and funding frameworks need to be there. Decision-making resources. So how do people make decisions? So that's about us as an information provider, generic information, but also advocacy. How do people need, and guardianship and other arrangements that help people make decisions depending on their capacity to do that. And other formal support such as allied health. Do you use the term allied health? Okay. In Australia, allied health means physio, OT, or it depends on what setting, but generally speaking, physio, OT, speech pathology, orthotics, any of those health support, professional health supports, we refer to as allied health.
We used to use it, but now we really
What do you use?
just use health sciences.
Oh, health sciences. That's right. We use that. We're still using allied development. So just to give you a little look of our country, Australia has a small population given its size. It's a population of 23 million, thereabouts. New South Wales, which is the dark shaded area, which is the area that we cover in our direct service, has a population of 7.5 million. So around a third of the country's population lives in New South Wales, and Sydney has a population of 5 million. So a fourth to a fifth of the population lives in the metropolitan area of Sydney. The vast majority of Australia's population actually lives in the coastal strip, from the northern border of New South Wales, and just above that, where the state capital of Queensland, Brisbane sits, all the way down that coastal strip across to down the bottom to that next border, the vertical border between Victoria and South Australia. Beyond that, people live more and more remotely, and it's quite common for therapists, for people to live 1,000 kilometres from their neighbour, the further into the centre you get. But for therapists in rural New South Wales, they may be 500 kilometres, 600 kilometres from their senior. So getting clinical support to therapists who operate in rural areas is really difficult. Suppliers won't drive a new item to show a therapist because they might drive one item and it might take them a day to get there. They have to stay overnight and drive back again. It's a costly exercise. My little company is funded by government. We in our core service, we do some income generation as well. So our core service is funded by currently our state government for people with disabilities and our Commonwealth government for seniors. I use the word Commonwealth and Australian government fairly interchangeably, as most Australians will. So if you're finding that confusing, I'll try not to do it. But if I use the words federal, national, Commonwealth or Australian, they mean the same thing. State means state. Eventually, our disability money will come from the Commonwealth via a new agency called Disability Care Australia. Our service is characterised by the fact that we staff allied health professionals. So all our staff are physios, OTs, speech pathologists, and then our admin team. We also have an access consultant on our team. We are independent of the assessment, prescription and supply chain. We're impartial to the entire system. And the AT suppliers provide us with all of the items in our display on permanent loan. The beauty of not purchasing anything is that when a supplier has an equipment upgrade, they come in and change it over for us, so we never have to worry about items on our display becoming obsolete. The reforms need to understand that it's an environment in which we're working. So both sets of reforms, the first one, living longer, living better, is for older Australians, so our senior population. The fundamental philosophy here is called client-directed care. So the clients have choice and control over their service type, service mix and the purchase of those services. So we won't any longer say to an older Australian and their family, these are your needs, this is what you need to meet those needs, and here is where they will come from. We will say, you have needs, let's discuss those. Yes, these are your needs. What service mix will meet your needs, and where would you like them purchased from? Our culture is, Australia is such a multicultural nation that it's actually quite difficult to manage the different expectations of so many different cultures without that degree of flexibility. Disability Care Australia is our new agency managing disability nationally. It used to be called the National Disability Insurance Scheme. Just as we have universal medical care in Australia, we are launched now into universal disability care. And this is what the system's called. It's called person-centred approaches, and just like ageing, there's choice and control of service type and purchase of service type, but also control of the money itself. So when somebody receives a package of funding through disability care, they can choose to give it to, oh, you're a wonderful woman. They can choose to give it to a service provider. A person can choose to use a broker to help them purchase their services, or the government will put the money in their own bank account. They can purchase everything for themselves and they equip back to government against their plan of purchase. There's flexibility within that plan of purchase, so they can make real choice about what is going to meet their needs and potentially say, well, I'll forego something else for the next 12 months because one particular thing is really important to me. Analogy that we heard recently that I think is really good is that the people with disabilities are now going to be the CEOs of their own lives. And so they'll choose different structures. Some of them will choose the private company model where they have complete and utter control and take the money into their bank accounts. Others will use a public company model like me and have a board of directors for people to whom they will help them with their decision making. And if they have limited decision making capacity, they actually do their decisions on their behalf. But that person is still in control of their life. So the fundamental starting point for us all now is that the person with disability knows their life, knows their disability better than anybody else. From time to time they need a range of supports to assist them to do that. So this is our new system. It's coming in over a 3-year period, and we have launched transition sites in a range of states across Australia, and each launch transition site is dealing with a different demographic. In New South Wales we have a rural demographic of 10,000 people coming into the system from the 1st of July this year. Children 0 to 3 are in South Australia. Adolescents to adults 15 to 24 are in Tasmania. The ACT, so that's Canberra, comes in 12 months' time, and Queensland and Western Australia won't come in until the end of the launch period. So during this next 3 years we're testing the system, and it's very exciting.
Okay. Does it mean that the government is going to adopt the system of purchasing items from the system?
No. The government won't be involved in the direct purchase of anything. That will be the client's decision and their broker or their service provider who they determine to purchase. Government's role will be to align the person to a value of package and supports to meet their needs, and then to link them to whoever it is who's going to do the purchasing or the delivery. They won't do that purchasing themselves.
You mean in the past were they doing purchasing?
That varied from state to state. Sorry, Devinder's question is about government purchasing. Disability has previously been managed by state governments, and the purchasing of items and services varied from state to state. In my state, New South Wales, in terms of assistive technology, prescriptions were written by therapists sent to enable New South Wales to have funding allocated, and they would complete the purchase and then send the piece of equipment out for modification or whatever. That system won't exist.
Excuse me. Just very curious to know that how did you start this program or this company? Have you done a background study for this? Are you not duplicating any other? Yeah.
My company?
Yeah.
No. My company is 35 years old, and it's the only one that exists in New South Wales. Government won't fund that level of duplication, and they don't encourage that level of competition for this model of service delivery. And in fact, we're not going to be competing for funds from clients either. The government's maintaining their grant process to us because they want us to exist, and are not going to. If people have to pay for information, they'll go and get it from somewhere else.
So the government won't allow any other similar sort of.
So,
No.
is it indirectly means that the coverage is only for New South Wales?
Our coverage, we have interesting coverages because we're a public company. So our core funded service delivery at this stage is for New South Wales. What we do outside our funded service delivery, because of our legal model, we do across Australia. And our website, which is a model of service delivery for us, of course, is borderless. And we do a lot of, we store data for around Australia, and this presentation is principally about our website, so I'll get to that again in a minute. So there's an ILC in every state, but we're not connected legally. We're a network. So we all do slightly different things according to our state governments. So part of this new disability care process is to make all that equitable.
This is fantastic. Do you come across someone else from some other states trying to have a similar model from your system?
We have, our model exists in every state.
Right.
And whilst we're not legally connected and the structures in each state are different, we meet regularly. We share a lot of information. We talk to government. We were all together in Canberra last Monday. But we're the only one of us who are legally national. So we have a better into Commonwealth government than my colleagues do. So we use my colleagues use our company to help. So they wouldn't have been invited to the meeting last Monday, except that we suggested that that might like to happen. So we were all around that table. So we're a network, we try to work together.
Just talking about the profitability of the company, how much, I mean, like you said, like it's partially funded by the government.
No, mostly.
Mostly, okay. Is there any registration fee from the members who are considered disability?
No, no fees.
No fees.
No fees. We're funded to provide it feeless. We received just under $1 million Australian dollars in funding. And we make, and some of that's in base money, base grants, about 800,000 Australian dollars in base recurrent grants. We receive a lot of project monies, so we currently have, let me see, from the government we have about 600,000 Australian dollars in project monies, and we have a foundation grant of just under 300,000 Australian dollars.
Wow.
We earn our own income as well, but we're small. We only have 13 staff.
Wow.
Okay. So our role in the system is supporting people and the system. So I only did this in my hotel room the other day. So we will see the system as a triangle or a pyramid with 80 users and their family at the top. In the middle, there's service providers and suppliers, and I include the allied health professionals in the service providers, and then the policy makers underneath. So our role is to support that entire system. Information to the top two levels, and information and advice, and telling government where they're going wrong and right is part of our role. So our advice is advice that keeps people participating, active and independent, with reduced care or completely out of funded service delivery. That's why government likes us. We actually reduce the level of funding people require, so we're very popular. And assisting carers. There's some research funded by the Commonwealth recently on assistive technologies and the mental health of carers of people with dementia. And it was shown that there is a really clear role for assistive technologies based around the carer rather than the client in protecting the mental health of carers. And it's a really interesting piece of research. I'm not sure that it's published yet. University of New South Wales Dementia Research Centre will be publishing it. We do a lot of systemic engagement and thought leadership work. So we're on every policy development advisory table in New South Wales, and of course moving to the national system, that's where we're heading as well. Okay, I'm just going to, before we get back into our funded service delivery, because I forget this important part of our business if I get too far into funded service delivery. Where in Australia we have organisations called registered training organisations, and their organisations can deliver vocational training, recognised Australian vocational training. We are one such organisation. So the TAFE network, if you know what the TAFE is, universities and TAFEs underneath, that's a TAFE level qualifications we're able to give. In the vocational training area, we provide training to architects, builders, landscapers, and occupational therapists in creating accessible environments and becoming access consultants. We have an access consultancy as well, and our access consultant, who's a qualified consultant, was a builder before he had his spinal cord injury. So he's also a person with a disability, and he does that training in that area as well. The other part of our training is specifically for allied health professionals. So we give training, a lot of our training is targeted at young therapists in simple AT things. How do you just prescribe a manual wheelchair? All about pressure care. Our favourite one seems to be getting a grip on grab rails. And we have a new one starting in September called Introduction to Home Automation. This training is quite popular, especially now that occupational therapists have joined physios in being registered professionals.
Yeah, talking about the training, you said you're going to train the allied health professionals and the built environment professionals regarding the standards of housing.
Yes.
But where do you draw the standards of the housing environment? Where is your basis of standards coming from?
Okay, it's not standards on housing as such.
What exactly?
Okay, so it's a very complex question. Australian built environment is quite a standardised environment. So the Building Code of Australia sets down the basics of the standards. Then we have Australian Standard 1428, which is our access and mobility standard that governs access to the built environment. It's called up into the Building Code of Australia, so it's law. Then on top of that, we have our disability discrimination access to premises standards, which is also called up into law and reflects Standard 1428. So that's fundamentally the public environment. The private environment is a little more difficult because there are no standards for something that is individual. So a lot of therapists draw on the requirements within 1428, which is a public access average environment, and then build on that. We're about to start training in home modifications as there's a competency framework for that now. There are no standards for the home. We do have, no, I shouldn't say that. There are new standards for the home. The Commonwealth has just released its livable housing design guidelines, which is about bringing universal housing into the marketplace. Some states have additional policies. In New South Wales, we have a policy called the State Environmental Planning Policy, People with Disabilities and Seniors Living, and it puts universally designed homes in the regular marketplace for the over 55s. I happen to live in one. It's fantastic. So my little apartment block has 6 apartments in it. All my neighbours are over 70. I'm obviously not, I hope. And they're universally designed, so you can come in later and put some modifications. It varies from state to state, and the Commonwealth is trying to deal with that issue as well.
Yes.
This is fantastic setup you are saying. And coming to give training programs for the builders, architects,
Yes.
etc. Do you involve those selected builders and architects to deliver those training programs? Do you involve them in the system, or it is given by?
No, they just sign up and do our training and go away with their certificate. But the Master Builders Association keeps a list of everyone who's done our course. They get continuing professional development points as well.
The training course will be given by therapists, or?
No, given by our access consultant. Yes, because it's access consulting. Therapists do it, and 3 of our therapists are also access consultants, and they'll help Hamish if he needs a hand.
Fantastic.
Hamish was in Korea, and he gave a paper on access and recreation. He's quite a character. So then we publish a journal called Independent Living. It's not yet peer reviewed, but it does go to EBSCO for loading up into search engines. It's a great vehicle for people wanting to test the publishing waters without having to go through peer review. We do have solid academic content to it, and we are moving to peer review. I think what we will do when it's peer review is we will have some of the journal peer reviewed, but we will open some of the journal for people to test those publication waters. I'm the editor, and I commission every article that comes into that journal, and it's the very important bane of my life. So who are our clients at the ILC? People with disabilities, their carers, families and service providers. Older Australians, their carers, families and service providers. Allied health professionals, because we have a funded role mentoring therapists, making sure they know what new items are out there. And believe it or not, our funding contract with government says, and the general community. So basically anybody wanting to know about anyone wanting information on AT and the built environment are our clients. Without charge, completely free. So if an architect or a private practitioner therapist rings up and asks for advice, and they're going to be charging their clients, they get that information free.
Why don't you charge them?
We're not allowed to.
Oh, you're not allowed to.
Because then we set up a situation where some people will expect more because they're paying for the service. We charge our access consultancy, we charge for training. Everything else is free. We have two models. Okay? So the first model is our direct model. So people can come in and see us and speak to a therapist and try and sort out their needs. We have a display. We don't call it a showroom because we don't sell anything. We have a display of about 3,500 items of AT, from a modified spoon up to a home automation system. Within our display we have a 56 square metre, one-bedroom department built to the Universal Design Guidelines, complete with home automation system, electronic cupboards that come down, special floorings, and it is absolutely beautiful. We approached Freedom Furniture, a big furniture supplier in Australia, when we were building, and they sent their interior designer in and free of charge did all the interior design, and we purchased their furniture at a low cost. And it's actually a very beautifully appointed apartment. It shows people that they can have a disability and need ceiling hoists, and the apartment can still look nice. So we do. We have two types of ceiling hoists in, and we have linked ceiling hoists. We have interesting joinery in the kitchen, show people how the kitchen might function better. It's the home automation system that's creating the most interest. We have a database of items, more than 10,000 items that are available in Australia and now New Zealand. We're adding New Zealand supply as well. So when someone comes in to see a therapist, they sort through what the person's needs are. They can look at items in the display around features, and then they'll go to the database and find the items that have the features that will suit the person's need, and then tell the person where those things can be purchased. Nothing in our display do we own, nor do we charge suppliers to put them there, nor do we charge suppliers to be on our database. So suppliers' items on the database, they just line up for us to put them on. When you have a look at the information, you will notice there's no marketing guff. The information we take it all out, it's all neutral. Suppliers don't mind, because that's what they expect. We have an info line, so people who can't come to Sydney can call us. It's a real skill to do an assessment over the telephone. Staff in the ILC have a unique way of working. Assessing over the phone in a fairly short space of time is an extraordinary skill. So they're all very experienced. You need to have a great deal of experience to be able to do that. We do a lot of tours and community visits. So by tours, people come to us in a group, and we show them around. And it's really interesting because a lot of seniors groups like to do it this way. They come in with a group of 10 or 15 people from their retirement village, and by the time they come out, they've all had their needs met. Not expecting to have their needs met on their way in, they're just coming to have a look. And we go out to community groups as well and do talks. The numbers, so that direct service, about 10,000 people access our direct service in a year. We're quite a cost-effective model, which is another reason government likes to maintain our funding. About 50% of our clients are seniors. About 20% of our direct clients are people with disabilities themselves at this stage. That will change. And about 30% are allied health professionals supporting people with disabilities. We have our indirect model, which is what we're going to talk about principally today, our website. We have a database which we call AT Magic, and at the moment it's a subscription. There's a public access to the database, but there's also a subscriber access. We were hoping that prior to going to Korea that would be the public access, but we're doing some web development at the moment and it wasn't ready. The other thing that's not ready is our virtual tour. So we currently have, well, at any one time we have about 2,000 subscribers. Some pay and some are getting freebie subscriptions. Subscriptions now are all free and forever. No one's going to be paying for subscriptions either. In the calendar year 2012, we had 483,000 odd visitors to our website, and we have about 40,000 visits a month with about 2 million downloads of information. And I sent Davinda the other day a Google Analytics for the last month for Malaysia. I've got that on my stick so we can show that as well. I find these things really interesting. What I didn't know, our Google Analytics suggests that when people from other countries are using our website, they can do so in their own language. And I find that very exciting, but it wasn't until we got to Korea that I was actually able to see it in its translated glory, and I was very excited. So internationally, the top 3 consistent nations accessing our website are the USA, UK and Canada, which is probably not a great surprise. And here you are, consistently ranked 8th on our list of rankings. Last year, just over 2,000 visits and 4,500 pages of information. The Google Analytics report I did for Davinda the other day, I like to look at the bounce rates. The bounce rates from your major centres are exactly where we would want them to be. Most visitors are actually intending to come to our site. But I was very interested to see Kedar had 2 visits over the last month, and I was wondering whether that was my daughter-in-law's family. Because I'm coming to Malaysia. We know that the website is used overseas. We have one family in Greece who use us all the time, and they send us little emails. They use our website and then they go trawling through Europe to find the supplier closest to them. We think it's very funny. So in line with the new disability service directions, we're making changes to our website. We already know that 50% of our clients are making their own decisions because they currently are not getting any funding. They have no option. In the new system, people are no longer going to be required to use an allied health process. In the old system, if you had funding, it didn't matter what your ability to make a decision, you had to have an allied health professional's prescription for an item. That's not going to exist. We also know that there's not enough allied health professionals to go around. Huge shortage in the 3 main professions of physio, OT and speech in Australia, with waiting lists sometimes up to 2 years for an assessment. We also know that many more people are going to be coming into the funded system. So we need to be supporting the decision-making capacity of people with disabilities. in making their decisions. We actually have funding to do that. One of those projects we're running the only pilot in Australia for training people with disabilities around the factors they need to consider when selecting their own assistive technologies, how to go about sorting out information, and more importantly, when to understand they absolutely need an allied health professional in the equation. And we're just recruiting to that project now, and it's a pilot run in the Hunter in our launch transition site over the next 2 years. We're looking forward to the outcomes. We're hoping they're positive. So just to take a look back to our website. Yes. In 2008, our state government said to us, we do not want you taking a van of equipment around the state showing people. We want you to develop a website that will support the information needs of rural therapists. So our target market were therapists in rural areas who may be a day's drive from their senior. And many of those very remote therapists are new graduates because they are the only people that can be attracted to those areas. So getting support is difficult. We're doing some work in the southern part of New South Wales at the moment. The senior OT for the entire southern third of the state is based just north of Canberra. His boss alone is a 5-hour drive for him. He has many hours to travel in and has a caseload as well. So the challenges of Australia's rural areas are quite significant, and we have to meet them in some way. So the government decided we should develop a website, and so we went and developed our website, particularly to address clinical support and to make sure therapists had access to information, not only new products, but on all products, because those suppliers of product will develop a relationship with a therapist, because the therapist will know who to call when something is needed. She may not be even aware that there are other suppliers in her area. That's our role. To develop our website, we went into a research agreement with the University of New South Wales and their human-computer interaction / usability department, and we used a usability evidence base in developing our website, which was very funny for staff because Dr. Daniel Wu and his team there wanted to make sure that the evidence around the way people interact with computers was the same for allied health professionals. So my staff were all dragged off to the laboratories. They all had iGaze monitors on, and they tested the way they used websites. I got to watch. It was very funny, and lo and behold, there's no difference between the therapist and the general community. But it was fun. Go figure that. We then went into a consultation phase. Just like providing services to people, you have to listen to the target market to give them what they need. And lo and behold, we thought we knew what we wanted to develop. But what we wanted to develop was not what the therapists wanted, so we had a quick change. And I think this is a fundamental thing organisations do wrong when they're doing a website. They develop a website for themselves. They don't actually develop it for the people they want to use it. So went in development phase. It took 12 months and $250,000 to develop what you're seeing today. It was launched in 2009, and our current batch of development is another $400,000 worth of development. For us, however, it's not a website, it's a model of service delivery, which makes it an entirely different kettle of fish. So we've integrated it into our service delivery, and all staff manage it. And some of this management of it requires things like every therapist has to learn to do video clips, editing, and to put film up on the website. So our changes are to suit the reforms. The person-centred approach to our website means our subscriber access stuff is all becoming public access. including AT Magic, the clipboard tools that we have, and our web media, all becoming public access. Very soon there'll be a virtual tour of our site, so people who actually can't come in and see that fabulous apartment will be able to see it online, and then click through to the database if they're particularly interested in looking at an item. When I get back, I'm hoping to be approving our YouTube channel. So all that web media that's on our website you will find on YouTube in a very short space of time, and we're opening a Facebook page. These decisions to do this have taken our board of directors about 2 years of risk management discussion. So our Facebook page will open not long after I get back, and we would use that as a means of communicating with people and collecting information. And again, the web media, new items will all go out through our Facebook page. So are there any questions before I open the internet?
Talking about the participating agencies, I think you said until now the participating partners with your company is the companies which manufactures IT equipments. But what about the other side of the partnering, like research universities, which comes with the prototype of equipments, which might be less expensive than your manufacturers, which can produce, competitive pricing. So, is there any precedence of setting up a tie-up with research universities, which comes with the prototype of all these equipments? So, is there any examples you have been done before?
Yeah, we have relationships with all universities. In fact, when I go back, I got to talk to the Faculty of Industrial Design at University of New South Wales for WaveTech and for iCreate. So I'll be making those links. We see their students all the time. We don't have commercial arrangements or research arrangements with them unless they ask. They ask us for advice regularly. The Australian manufacturing scene is quite different. We don't actually manufacture much AT at all. Manufacturing in Australia is a really expensive thing to do. Our labour costs are very high, and it's a very small market. Our population is only 23 million. So we import nearly everything. We design a lot, and we import nearly everything. Everything has to come through an approvals process. You can't sell anything in Australia unless it's been approved by our Therapeutic Goods Administration and meets Australian standards. So selling in Australia is also difficult, it's not easy.
And my next part of the question is, your partnering companies are only from Australia, or is it from across other countries? And is there any chance of these manufacturing companies also having a type with other agencies across other countries, promoting other websites, or is any? And the client has got an open edge to see across other websites, other countries. So, is there any possibility of having this kind of scenario in your?
Yeah, and I might show you some of that on the way through the website.
Okay.
And I hope I answered the question on the way through. We're part of an international alliance called the International Alliance of Assistive Technology Information Providers. So all the other websites and databases like ours, you can link through to straight from our website. That may answer your question, I'm not sure.
Is there a difference between, because I'm on the sign-up page now of your...
Oh, are you?
Yeah, and it says here, you can have a free trial account,
Yes.
and you can also subscribe. But is there a difference between the one which you can have now?
I'm going to demonstrate that. Yes. That login page where it says the free trial, that free trial now is ongoing forever and ever.
Okay.
We're not going to be charging people for that
So
subscription.
for the subscribers, what will you get?
I'm going to show you. Eventually, very soon, that'll be all public access and you'll get all of the tools free.
Sorry, may I ask you this?
Yes.
It's amazing you are managing the whole thing with 13 staffs.
Yes.
See, it's really hard. Just curious, who will shoulder the salaries for these 13 staffs? Is it from the government?
Government.
Okay.
That's where most of that 800,000 goes.
All right.
Okay? That runs the company. Okay, the money that we earn really just props up a few extra things. Okay. Now, shut that one down. And here we are. So this is our website, the front page. And as you scroll down, oops, I hope you're scrolling down. I'll use that, I think. As you scroll down, you'll see, firstly, across the top here, the usual things you find on the website, and our vision and our purpose, which needs updating, a search bar, a capacity to browse, general stuff about what we do, interesting information, and there used to be a banner for I Create on that as well. So just to show you a few things, in under who we are, you find out all sorts of stuff about us. But down here, to show you specifically, these are our International Alliance members. Whoops. Here, and each one of these countries has a model the same as us, free information delivery on assistive technology. We're all originally based on the English model, which is the DLF model there. I have favourite sites. One of them I can't pronounce. And when you click on the English translation, they have a fantastic AT research library. Ditto the Italian site, Portale Siva. And Portale Siva is a research institute, so they also do research. And much of the research around cost effectiveness of AT has actually come from this institute. So if you want to find out what's in America, you go to Able Data, UK, DLF, etc. We have a webinar with them in October, which I have to attend at 2 a.m. in the morning. I'm looking forward to that. So I'll just go back to the home. So along here, we have some things about our Access consultancy, how to access that, and some of the work we've done. Just general information. We're advocates for universal design. And here, things about our training. Over the next 12 months, we will be purchasing and putting in place an e-learning platform as well, and delivering some of our training in a more sophisticated manner over the internet.
Will it be charged?
We will be charging for training. We charge for training.
Recently, I come across this dementia service care training, something from University of New South Wales.
Yes.
And they have a similar sort of training, and
Yes.
it was open free for.
That's because it's funded. I'm a member of the University of New South Wales Dementia Resource Centre.
Yeah,
Yes,
that's
they're
right.
funded to provide that. If we're funded to provide something, we don't charge for it.
All right.
Yes. That's the way it works at home. So these are our courses, some of them. Accessible buildings, environments, continence, dementia, easing the pressure, getting a grip on grab rails, seating. As you can see, they go on and on forever. POD is an interesting one for the speech pathologists. We have speeches here. We have, Gail Porter has started a pragmatic organised dynamic display system, and outside of Gail's own work, we have the only person she licenses to deliver that training in our site. So we actually deliver the POD training all around New South Wales and into Queensland. Gail's finding that it's hard for her to do all of it. Now, what I'll do now is just show you what the information looks like, and then we'll get into the search tool, the login tools. It's blinking. Bingo. So people can browse and they can browse by category if they want to. Or, I think a bit later on I'm going to be nice to the speech pathologist and we'll do communication. Although I like to show, no we won't, I'll be nice to the speeches now because I'm wanting to show things with bigger features. So, you type in, it helps to be able to spell Robyn. You type in communication. Still is thinking. It's thinking. We have 605 products on our database that relate to communication. And here they all are. And I'm going to open up one of them. And this is how we present the information. So there's a general description, and you will notice that not once in this information does it say this is the premier piece of equipment in Australia, because we've taken all that language out and we have rules and my staff will rewrite. And if they need to, they review the item. So most of these items have been reviewed by staff as well. The basic features and the basic options. Scroll down a little bit more and you can change the picture. If we have more than one picture, sometimes we don't. And there it is. There's the approximate price, and there is only one supplier in Australia. Some items of equipment have a couple of hundred suppliers. So then we have the short description and our company disclaimer. Oh, that's funny, that's normally in a line. Things about the models and the options. What else are the dimensions.
It's got a lot of information there.
Huge amount of information. And then here's the supplier down the bottom. So this is where to purchase it. You can only purchase it from South Australia. I won't do it, but if you link on to that one, it'll open up the Google map and the details of the company, their email address and website, or you can cut to the chase and go straight to their website. So you can email the supplier directly from our website to ask them a question.
Sorry, I believe that you are monitoring the quality of the products, what they do. Can you share us how do you ensure that the products are monitored for good quality?
We actually don't have to do that. That government does that for us through the Therapeutic Goods Administration.
The meeting standards.
They have to go through a process to be sold, to be allowed into the country, and to maintain their place in the market in the country. So yes, we actually don't have to do that.
Thank you.
The TGA is the same as the USA's FDA. So let's log in now and I'll show you the tools. So have you signed up for your freebie yet? Oh, excellent. It didn't take long, did it? What was your name again? Nor already has his freebie login. He's already applied for it and it has been granted. So he can follow along. What am I doing? It's always harder when you're typing on somebody else's laptop. Wrong password. You'll need to, if you're going to use this facility and you're wanting to store the clipboards, you will need to register an email address because you can store client information on our website. It's very secure, and so only you will have access to your clipboards. If you don't register an email address, the clipboard you've been working on will disappear once you've logged off. So you'll notice that we have a few other things here. We have still capacity to browse. We have a supplier directory, and there are 2,500 suppliers in New South Wales. And forget the rest of Australia, we're also loading them. We're access to web media and our clipboard facilities. What we're finding at the ILC is people with disabilities are already using the website. They've been coming in and getting freebie subscriptions on and off. We monitor who's getting freebie subscriptions, and if it comes from a government department, we don't let them in once they've used it a couple of times, or we will now because it's all free. But if it's a private address, we let people just come in and come and go as they please. But we find now staff are often talking to people on the phone who've been through part of this process and just want some additional advice. So we're going to search. We're going to pick wheelchairs. And let's think. 1,000 products have the word wheelchair in the description. Just scroll down. And over on the side, you can refine. So we're going to start, we definitely want to talk about wheelchairs. Now it's okay, so now we are at 297 actual wheelchairs. Sounds a bit low to me, and I've taken a few off recently. And here they are. Now, for some reason, this toolbar's not displaying properly, so I hope that we're going to be able to do a couple of fancy things. So, you guys have control. How would you like, what would you like to look for? Would you like to, what sort of category, client, feature? What would you like to look for?
Stand up.
What? I love, who said that? That's my favourite category. I do real physios. Stand-up wheelchairs. I love them. We were fortunate, we did a session for a ride rehab centre about 2 years ago now. They approached us for some information on stand-up wheelchairs. So we organised for every stand-up wheelchair on the market to come in, and we shut service down for a few hours while we had ride rehab over to look at them, and we were fortunate because Otto Bock at the time had a prototype. The prototype was in Melbourne, so they shipped the prototype up from Melbourne to Sydney so that Ride Rehab could have a look. And as a result, Ride Rehab has gone ahead and bought a range of stand-up wheelchairs. So we have 10 products in the stand-up wheelchair range. And again, you can refine by feature, by client type, by load capacity, seek width, depth, by specification. So you can actually select something within a whole range of your criteria for a client and refine the product down. Sometimes you might have overdone it, might end up with nothing to look at. You might have to backtrack. But does anybody want to look at anything in particular? Do you want to have a look at a manual or a powered one?
Manual.
Manual one? Okay. The powered ones, I have a favourite powered one or two, the Otto Bock and the Permobil, simply because you can drive them in standing. Yeah, which is really great for young men at the pub with their mates. They can actually go to the bar and order in standing and back again. And for an Australian male, that is such a distinctly social thing to do. I won't be technical. Permobile, a little bit crude. Permobile have an ad for their stand-up wheelchair, for their paediatric stand-up wheelchair, a review behind of a dad and the son at the urinal with the son standing up in his wheelchair. It's actually a very cute ad. So we have 5 of them. Okay? What we're going to do now is we're going to put a couple of them onto a clipboard. And as the page isn't displaying across the top, I'm really hoping the technology gods are good to us today. So we'll choose, which ones would you like to look at?
The second one, please.
This one?
Yes.
I just have to create a clipboard. So creating the clipboard is not. Yeah. I'm going to call the clipboard, believe it or not, UKM. Okay, so we now have a UKM clipboard. We'll just do Oh, okay. We'll make it, that's a surprise.
As it is getting uploaded, just a question. So you are actually connecting people who are with needs with the government, actually are connecting them. In this process, have you any time encountered any legal challenges or sometimes or
No.
people?
No, we have full whack of insurance.
All right.
We cover ourselves, but we've never had a problem.
Problems, yeah. I was just thinking, we are empowering people with knowledge to make decisions.
Yes.
Not everyone may get exactly clearly what they want.
That's right.
So sometimes the perception of what they need is not what they want, and they may end up with something untoward incident. Anything like that?
Not yet.
Thank God.
We're expecting to have some.
Really?
Yes. Oh yes, if you open the system up the way it's been opened up. The only thing we can tell you is that in the UK, where the system is similar and has been working for about 20 years, they don't have a problem. And in the pilots that have been run in Australia for the last 10 years, there hasn't been a problem. And the 50% of people who already make their own decisions, there hasn't been a problem. So we're not really expecting a problem. Well, we are expecting to have a few problems, but we're not really expecting to have problems to any degree that creates a whole stack of legal issues.
And all this 50% of your population who use the service are managed by this 13 staffs for counselling, is it? Or
All of them, all the 10,000, yeah.
handled by these 13 experts?
Well, actually no, because 13 includes admin, me, our accountant.
Okay.
We have 6 allied health professionals. Yes, all handled by the same 6.
We're talking about the 2 models. I think the first model is the direct model, right?
Yes.
So under the direct model, clients coming to your apartment or your office,
Or on the phone.
do they need to have a referral from the therapist?
No.
So what is the judgment? I mean, probably the service is coming from the office. They do a consultation. Is that right? Your office people do a consultation on the requirements of the client.
Yeah, that people can walk in off the street and see us. They don't need a referral. The admin staff don't work with the clients. The client can either walk around and have a look if they haven't got an appointment, or wait till the therapist is available. And the therapist will sit down with them and go through.
And then the next thing is, I think we are in the era of information revolution. Why don't you create apps for the iPhone, Samsung, into a more interactive, capsulated module, rather than spending time on the.
Wait for it.
Okay, I'm just looking for those.
It's coming. It's coming.
It will be coming.
Just curious, in Malaysia here, we frequently hear this concept of one-stop center
Yes,
for multidisciplinary.
yes, we don't have them
approach.
in Australia.
We don't have them. I was wondering that some of your needs, like communication devices, maybe for speech and audio, how does a therapist make a decision on what is their need?
We have speech pathologists on the team.
All right.
Anything that's highly specialised will go to the staff member that has the expertise.
All right.
Yeah.
So your team is actually a multidisciplinary.
Interdisciplinary. I'm a big believer in disability in particular, interdisciplinary and transdisciplinary teams, and certainly our model fits very often transdisciplinary process, but interdisciplinary team. Yeah. There are very few places in Australia in disability that are multidisciplinary. Most of them are interdisciplinary, and many of them transdisciplinary. And the reason there are very few one-stop shop services is that government believes that people are best served if they are served from a mix of places.
Hearing aids as well.
No, that's specialist service for hearing aids. So we've made our clipboard. We wanted to put another one on it. We're having to go back to our search results. Thinking again. I must have pressed an extra button. It's been very slow. So, you need to select the second wheelchair. Put on that list. Which one would you like? Pediatric chair. We're going to put that on the clipboard. There we go.
You just read it.
It's on there, good. So, we'll go to your clipboard. Here it is. So you can add client detail. And remember, this was developed for therapists, the language will change. So you can put in a whole stack of assessment information onto the clipboard and print it out so it's like an assessment with the AT outcome as well. So the idea being that people with disabilities will also be able to put whatever they want to put on the clipboard too. So in here you can add notes. Mother likes this one, or this particular feature is particularly good for this client. It fits well into his bedroom, whatever you want to put on there.
The assessment summary and case description, are they accessible to public?
No. It's only you.
Only you.
Yes. I've logged in. This is my area of the website.
I think your organization regularly, I guess your organization will regularly monitor the feedback from the clients and also from the other party regarding the compliance, how is testimonials. Is there a constant monitoring system there for them?
No, we don't have a constant monitoring system because, believe it or not, people don't have to give us their name.
Or is it?
We can be anonymous, but given we do try and we do collect feedback when we can. A lot of people are quite happy for us to give their name, for us to collect their name. Some of the project monies we have around consumer capacity, we have to do some solid evaluation over, and we're actually looking forward to finding out that we get lots of letters saying thank you. We get very few that didn't work out. So who knows? Australians are very good at complaining, so we're not overly concerned.
In such instance, what would be your course of action if they are not satisfied with your recommendation or with your information that they try and they come out with their complaints?
Well, I think it gets to, we don't actually tell them what to buy.
Right.
We give,
It's more guiding.
it's their choice, and we try always to give them 2, 3 or 4 options. My brother-in-law is a wheelchair user and they use our equivalent in Queensland, and she loves it. She says she comes up with 30 pieces of paper and she sits on the dining room table and tries to sort it out. So we don't actually tell people what to do. We give them recommendations and a range of recommendations that may or may not meet their needs, and they need to then go and do that last little bit of selection. Now,
I believe your clients also coming back from different practitioners. I have my patients coming to me having seen 4 or 5 physiotherapists. When they come to me, they compare opinions across the table. So do you come across like that?
people come back to us, generally speaking, because they like the information they got. We're finding more people, though, come to us because they need to have an argument with the therapist they're working with.
Yeah.
And that's fine too. I'm actually having trouble dragging. Is there any reason why this isn't dragging? Normally, you drag these into there, and all of those features and everything all line up on the page. So you can go across and just check, you know, which items has the features that you want and the dimensions that you want and the load capacities that you want. And I'm really disappointed for some reason this isn't working. It was working yesterday.
Probably the browser compatibility will know.
Pardon?
Probably the browser compatibility, sometimes it...
Might be. No, it's thinking because it wasn't thinking before. It's just a simple drag and drop, which doesn't work on iPad yet. It's very disappointing. Oh, I can't show you that. Never mind. Moving right along. So after you've done that, you can select which one you want. Thinking. I'm very disappointed I couldn't show you that. Because what some therapists, I had one therapist at the Cerebral Palsy Alliance was showing a mother a stack of wheelchairs to move the child into, and they narrowed it down to 4, which was nice because it fits our 4-item comparison. And so she clicked, drag and dropped it, and then printed it out on an A3 sheet of paper and gave it to the mother for the mother to take home and think about. And that's a really good way of using that. So we're going to choose the children's one. Now we have to choose the supplier. What are the suppliers? I didn't see that before. Whoops. Here are the suppliers. How many have we got? So we can choose suppliers that are close to somebody's home if there's one. So there's 1, 2, 3, 4 suppliers in Australia, and I've got no idea where that is, but that's the importer. So we can choose the one in Cooma. There's one in South Australia. ACT.
Orders from overseas, they know how they have to contact their own local suppliers, isn't it?
Mostly, yes. The importers, some importers like Permobile have a big site in Sydney, and then they distribute through their supplier network. So most importers have a distribution network. We put the importer detail on the website as well as the supplier detail. Because sometimes there's not a supplier in a particular state. So in a state like Western Australia, where the population is really, really small, Otto Bock or Permobile might not have a supplier. So a person will either go to a supplier in another state, which is why we store that information, or they ring the importer directly and find out how to get it. So just because something's not available near your home shouldn't preclude you from buying it. So we're going to Cooma. Cooma's near Snowfields. It's not far from Canberra. Thinking is thinking. And here's the recommendation. If there's different models, you get to edit the models. You get to take options out and you get to add additional comments. Here's the supplier with the details, website, the email address, and if you've received a quote, and you can type in notes as well. And then you can print and save. So it prints and saves as a PDF. But let's just go back. So they're the web tools for decision making. I just want to show you something else. So we might go to, this way of doing that might be new search.
So if the client had to choose something, will it be delivered to their home? Or
Yes,
something?
yes.
So what happens if people outside the country like purchase something through the web?
Well, you can't purchase through the web.
Yeah, but we are going to the supplier, right?
Yes, I'm sure the supplier would either have a distribution, if it were here, they may have a distribution network here, or they would ship it here. Yeah. That's what happens in New Zealand. So New Zealand's very small, so people wanting to purchase from Australia, if they're using our website, they go through to an Australian supplier and they ship it out. So I can't see why that wouldn't happen somewhere else. I'm going to now go back to here. Thinking. Because I want to show you this. This is the fun part of being a therapist at the ILC. I doubt very much that they would necessarily agree with that. But if you can't find a therapist, it's 9 times out of 10 they're sitting at the editing table, editing web media. It's actually quite a fun thing to do. Says she who can't do it. I'm only the CEO. So, as that's loading, I'll show you down here. We have a range of web media that will also be in the public area very soon and in YouTube. So we're actually really putting ourselves out there with our web media. We've developed in sophistication since we've started doing this. You'll find the early ones are all a bit staid. We won't talk about these two because there's not many therapeutic discussions there at the moment. The tutorials about how to use the site. These little education models are principally aimed at new graduates. Introduction to personal alarm systems, introduction to hoist emergency features. So very often a young therapist may need to help someone to find something, and they and the client have got no idea what it looks like. And so this is a way of doing that. We also have AT demos. These ones are different again. So these are from the supplier. Suppliers are very funny. They love to do this. When they bring us a new item to show us, they come dressed ready to be filmed because they know they're going to get filmed. As they're demonstrating the item, they're talking to therapists and therapists are talking back to them. Sometimes that conversation is edited out, sometimes it's not. It depends on the critical nature of the conversation is probably a nice way of putting it. Sometimes my therapists have to say, but actually that's not what it does. So the suppliers love to do this because it's a way of making their new items, people aware of their new items. When they first start, we allow them to talk about their company. There are rules about how they conduct themselves during this. They conduct themselves to the rules because if they don't obey the rules, they don't get asked back. We allow them to talk a little bit about their company. They cannot make outrageous claims like this is the best thing in Australia and we are the best company. They can't do any of that nonsense. So I'll just show you this one because it's new. Caused a bit of a stir at SPD yesterday, this one. I left with one of the staff who has a disability totally engrossed in this clip because he wants it. So I don't know how to. So this is a brand new item, and the supplier has given us these items on a driving stand. So people can actually sit in their wheelchairs and try all the bits and pieces out. The most amazing part of this is the wireless control. Can you all hear that?
Yes.
It's going to do a load and a reload, I think, by the look of this.
My name is Paul Craig. I'm from Total Ability. We are the Australian imported for five-wheel driving.
Paul is a paraplegic. You might notice as he's moving around, he's not exactly moving around in his chair. He's in a very cute little sports wheelchair. Pity we can't show you that too. Oh, what a pity.
And we're now working with new stores throughout Australia.
If I escape, will that allow it to load?
Yeah, perhaps we pause it for a while.
Okay.
We pause it for a while and then get loaded.
Maybe.
Sorry, that's the first. Yeah.
So find it. Okay, so we'll just pause that and let that load, unless you have enough of an idea. So this is our model in support of information use of rural therapists, and very soon it's used a lot. I shouldn't say that. It's used a lot by individuals, and very soon all of this stuff will be completely public accessible without subscription. And the idea being to help people make decisions about their equipment.
I have a feeling the therapist would love to spend time surfing your site.
Please
and,
do.
And find certain things which are relevant for their patients.
Yes.
So if I am a therapist in Malaysia, would I be able to
Yeah, of course.
see this and
Absolutely.
recommend this for my client?
Absolutely. Absolutely. It's no websites have no boundaries. And so please go ahead and use it. It's already quite well used from Malaysia, so please do so. The way it's also used in Sydney is Sydney University and Western Sydney University students who come and do, we had 120 of them at the office last Friday. After that I wasn't there. They use our site to assist them with some of their assignments as well. And we would encourage that too. Anybody can sign in and use the site. It's not a drama where you live or where you sit.
Yeah, that's one of the agenda in my mind. We are also teaching our students. So definitely there are some projects and assignments we will tell our students to study and report.
Yeah, look at, even you get to looking at hoists for people. Some of the dimensions of a hoist are really important because you might not be able to get the legs under a bed. So a student to be able to take that on board and come in and find the one that will fit under the bed is quite important. That they can be used for that. So instead of having a student or a therapist spending hours poring over catalogues that are also containing marketing guff, you can actually get the information quite quickly by coming onto the site. And we'd be more than happy if that's the way the site was used. But for me, it's important that our site is used. As long as I can say to government the site is used, they'll continue to fund it.
I think the whole idea is quite interesting. Since you have a huge percentage of government backing up, is there any idea of getting into a research of this? I mean, testing the systems across borders, across countries, doing a research kind of activity, or are you trying to find people who do research of? I guess that a lot of publication has been done on this kind of model.
We'd love to. We'd love to. anybody wants to do some research on our website, how it operates and its usage, we'd love to. The only thing we do is take our Google Analytics stats regularly.
Yeah.
So every month, as part of my monthly report to our directors, our Google Analytics stats go up, and I report to our government body. They're happy. All our government wants us to do is to prove that it's used in rural New South Wales, and I can do that really easily. They're thrilled that it's going elsewhere.
That's interesting. Where does then the policy and the practitioner stands in terms of evidence-based practice in this?
So I believe that's you guys. There's not a lot of evidence for a lot of AT, as we all know, and it would be wonderful if there was a lot more. We don't do research, we're too small, but we certainly get engaged in research agendas. So I sit on the Dementia Advisory Research Centre at University of New South Wales. I'm on the Hammond Care Research Advisory Group, the Enable New South Wales. We get involved at the research advisory level because we think our role is to affect research agendas. And if we can do that, because we're only small, if we can do that effectively, then we can play our part.
One last.
The policies don't stop you, meanwhile.
No. We can do what we like. Yeah.
One last question. I think it's quite interesting. Until, I mean, I guess like you've been spent 35 years of, I mean, like in this thing. I just want to know, what is the how do you manage to do before this web-based model? What was the model existing?
Would you like to guess?
How do you manage to do this thing before the advent
It's
of?
a system of cards. So when you saw that the browse categories, they're the browse categories that existed 30 years ago with a few minor alterations as technology has changed. And each category had a system of handwritten cards. And so staff would sit with the handwritten card and pull it out. And if you were lucky, you had a photograph. But of course, the extent of assistive technology wasn't as great then as it is now. So thank goodness technology was developed, because it would be so hard to manage on the old card system. The card system for the ILCs is famous. All the old therapists talk all the time about, oh, it's so much better than the old card system. So, yeah. Only one, we lost our card system to a rubbish bin, I don't know when, before my time, which I think is a shame. I think the Western Australians still have theirs locked away, and I'm wanting to see it, physically see it, because in terms of history, it really shows how things have changed.
Yeah, it should be gone to museum, not to the rubbish bin.
Exactly. So, any other questions?
So if we want to do some consultation, say, I'm sure your therapies may be more experienced.
I had this question yesterday.
Is it possible for us to
We can do a Skype video if you would like. We've just bought a smart board, and we're going to be able to do our Skype talks through the smart board. We can do that if you would like. It's just a matter of organising a time. We'd be more than happy. My staff would be absolutely blown away to be able to do something like that. So they like to do the different, makes a bit of variety to their day, and I'm happy for that. So, any other questions?
Amazing.
Good. Glad you like it. We like it. It's quite unique. The webinar with our International Alliance in October is actually about our websites. And our website is the only website internationally with those tools. There is another Australian website that's run by my colleagues, funded completely differently, and we don't have anything to do with that site. Look at that as well if you like. It doesn't have any tools on it. It doesn't have web media and fancy stuff. It's funded entirely differently. Ours is funded as a model. The other website isn't. So
It's curious. It's so well. It's very good and clean. But how far the hospitals or the policy directs the hospitals to directly liaise with this system?
because it's funded, the hospitals have to use it.
Yeah.
So the therapists in the hospitals all have subscriptions. And until they became free, the New South Wales Health and New South Wales Disability Services would send us an order for subscriptions every year.
So in terms of your clients, any approximate statistics on how much of clients directly walking to you, to your system, and how many of them are referred from hospitals?
Most of them are referred, most of the ones who come by themselves are actually referred from hospitals. The hospital will say to them, the classic is, they have a friend in, they have a family member in hospital and leading towards discharge. The hospital will say, you need to go to the independent living centre and you need to ask them about X, Y and Z and anything else while you're there. And so we have families turn up. The other interesting times, the time I think it's funny is leading up to Mother's Day. You've got no idea how many groups of siblings, all in their 50s, come about 2 weeks before Mother's Day because Mum needs a comfy chair or Mum needs something, and they're doing their Mother's Day purchasing. We're very busy in the but not so Father's Day, I might say, but very busy leading up to Mother's Day, and it's classic. You can say to the girls, you better get all your CD information ready. Mother's Day is only a couple of weeks away. So, any other questions? No? Well, we'd like to stay in contact, and I have Davinder's contact. Can I just say too, I don't know, I said, in Australia it's actually quite rare for a physiotherapist to be completely in the AT arena. It's seen very much as an OT thing and a speech pathology thing. And I think yes, I know. And it's been wonderful for me to be in this, for me, an OT arena. People think I'm really weird being a physio and managing OTs. I actually lecture OT as well. To go to Korea and sit down and be introduced to Davinder by another physio and sit at a table of physios. I couldn't believe it. It was wonderful. So I'd like to stay in touch, and if we can work together on anything, I'm really interested in research. We have no boundaries around what we do, so government's happy for us to go off and do what we want to do. So provided we abide by the funding contract, anything else we do is green for them.
Do you have anything to float across the table now? So we go back and think and start to find areas where we can, if we know what is the area of interest, then perhaps we can.
We have several areas of current interest. We're really interested in home automation. We're not so interested in monitoring systems. We do a lot of work around monitoring systems, but we're really interested in home automation systems for functional independence. And there's not a lot of understanding about what they can actually do. Because we now have a site with a home automation system in it, we are starting to get an understanding of its power. So we'll ask, Clipsal provided it, and we ask our man at Clipsal to come over from time to time. Conversation goes something like this, because Clipsal set it up for luxury housing. Conversation recently went like this: Adrian, a PowerPoint over there in the kitchen. Can you deliver power to it across a set time for a set period only? Yes, of course. Okay, so Adrian, if I have a mother at home who's in the very early stages of dementia but managing quite well by herself, but in the morning she likes to cook bacon and eggs and she's had a couple of little small fires, would it be possible to set up that PowerPoint so that when she plugs the fry pan in, it only delivers power between 7 and 8:30 in the morning and only for a 10-minute period? Yes, of course, he says. I said, this is a really good application. Oh, is it? Why? So we're trying to work with Clipsal on identifying some of the areas facilitate function. And we're finding that really interesting. There's not a lot of literature. It's very, very new, and certainly there hasn't been a great deal of research. We'd be interested in, and I know governments are our government certainly is, I'm assuming every other government would be too, in whether there's a cost benefit. And I'm expecting our colleagues in Italy to be already on this, because they've done what we've done, they've built a home automation department. Whether there actually is a cost benefit to utilising home automation. So if someone can manage all their lights and their electricity in an automated manner, does that cut down on the amount of personal assistance they require? So it's a really interesting question. People in Australia can get automatic front door openers because it means that a paid staff member doesn't have to be there to open the door for them. So does that work in an automated apartment as well? What's really interesting is that for the speech pathologists in the room, there are some AAC devices from which you can operate a home automation system as well, not just an infrared turning on and off capacity. Autobock have just produced a powered wheelchair control that can operate a home automation system. So these things are very new, and we're really interested in that, really interested. That's where our principal thinking interest is at the moment.
It's interesting. It's an interesting challenge for a physio to think on engineering aspect.
Absolutely. Physios, I have to say,
extending the
are capable of thinking from that angle, because our training is very often it is actually mechanically based, and the body's just a system of levers after all. So I think it's not outside the scope. However, we have an OT in our service who is also an engineer, and we are utilising those engineering skills within the site as well in our company. So we have a capacity to do some of that thinking. So it's finished. I finished. Oh, it's already, okay, can you see this? Young men like these too, because they're actually really good looking products. Can you see?
So a lot of the group is becoming electronic oriented. So I'll introduce you to the first area accelerator. Obviously these have been, people have known about these for a while now, but they've really seen it. So very simple process. It sits on the outside of the steering wheel, and that provides acceleration. So the front unit is a very well made unit with a very smooth mechanism, and it's also backed up with essentially the same CPU computer, which then talks to the car's computer. So all the training acceleration work on the same principle. So it means you can actually program the acceleration curve, which makes a lot of difference if people have slight dexterity problems, and also depending on the vehicle. So obviously whenever we do an installation, obviously we're very focused on trying to get that nice smooth acceleration. So that's an over. We also do an under. I don't know why most of you know. We also do the accelerator on the brake lever. So that's the accelerator option there. Once again, it's electronic. So partly I'll do a push pull, which is more in a traditional area. And I also do what's recently introduced, the satellite accelerator. So this is what I drive with. I've been driving with this system now for 5 years, and I would never go to anything else now. So basically you can hold the steering wheel with two hands, and that's the acceleration. So the actual steering wheel is going through there, and so it doesn't affect your steering whatsoever. You can have 2 hands on the wheel, 1 hand on the wheel, either. You can also remove this hand on the brake.
He took staff for a spin in his car while he was using this. It's amazing.
Just air conditioning or just other secondary functionalities that they
How come you modify it?
and then a little setup.
You have to take it to accredited in Australia to an accredited modifier, and then you have to have a compliance certificate before you're allowed to use it.
Of course. And
These are approved, so it's not too big a drama. So as well as being approved for sales with the TGA, it has to be approved by the Road and Traffic Authority.
So we don't want people going out when they're in the process of driving. So that's why we don't describe for those features. So we also have moving on to the brakes. We have the standard five-wheel brake arm. So it's got obviously just a pushing mechanism for braking. It's also got a locking mechanism, like it's not like a park brake. It's also got a horn and got an acceleration lock, which works similar to cruise control, similar. So that's the standard brake arm, and it comes in multiple colours. So moving on from that, we have the brake arm with indicators, lights, horn built in. It's also got so maybe in the evening or dark conditions you can always see. Once again, it's got the brake holding function, and this can be operated with kind of standard technology where it's big flame candles and V-bus and also some standard wiring loops. So we also then have another accelerator. So we've also got brake, and then that's the accelerator which I mentioned to you before. So patients needing a little bit more leverage, this is another option. You can actually just change the end in mounting, and you can put something like this in. So it provides more of a holding. And then from moving on from this system, we have this really interesting unit, which requires it's basically mounting into the end of the brake arm. And the acceleration is there. So it's an electronic accelerator. It also has, you can see buttons at the top and the bottom. And those buttons can operate the indicators in the corner. So for a minor coil, it's still got a reasonable arm function, but it has no dexterity. This is
This is a very long one.
Can I ask you
Yes.
2 more questions?
Yes, of
please?
course.
Sorry, I'm very impressed. Have you ever had this dream of this at any point of your career? That's my first question.
Had a dream of.
About a dream like this, a vision like this.
Yeah, that's my vision.
Is it
Yeah,
now?
it's my baby.
Okay.
Yeah, the apartment in the site is my baby too. And staff are really interesting because I have another baby developing that we're waiting for funding for. And when I have a baby, I don't delegate it until I'm happy that the baby's going to grow up the way I want it to.
Yeah.
And staff are actually quite used to that. And so they know when I've got a baby developing. And then when they're engaged in it, they get to do that. And then when I'm happy that I can delegate it, I delegate and go on to something else. But yes, this was my baby.
I'm surprised because it's a quite out-of-box thinking from a routine
Yeah, yeah.
physio. And,
No. OTs and physios think outside the box all the time.
What's the biggest challenge for you in this journey?
The biggest challenge for me in this journey, well, you'd be surprised. The biggest challenge for my journey in this was bringing my staff along for the ride. This is because it's a model of service delivery. It did require some shift in thinking for staff that managing the website was as important as managing the rest of the business. Staff have always understood that the database of equipment was the heart of our business. We had to look after it. But they didn't initially see that the website was equivalent to all the other service delivery that they gave. We did lose some staff over that, but the staff who are on board, certainly now we love our website, and staff would be horrified to think that we would no longer be maintaining it in the way that we're doing it and continuing to develop it. And I guess that's something too, that it's that continuing to develop it and develop its model and to shift its model is like every other model of service delivery. You need to be changing or you get left behind. As an information provider, I think some of our older therapists felt that we didn't actually understand the notion of information provision, and the environment of information provision requires you to take the internet seriously, and that was the shift that happened. We had another interesting shift in thinking when we built the universally designed apartment, home automation system and everything. That was my baby. I was determined that we were going to put one in and display AT in situ. And I made a mistake in assuming that staff understood. Staff were therapists, we were working together. So we go across on the first day and we're bringing all our stuff in. And staff started saying, we don't have enough space. So what do you mean you don't have enough space? You have more space than you had before. We need cabinets to display. We need display. We do have some display cabinets. I said, what do you need display cabinets for? Oh, we need a shelf to put the cutlery in. I said, you've got kitchen drawers. You put everything in where you would find it in the apartment. So a couple of days later, they're very proud of it. Oh, we've put everything away in the apartment. Would you like to come and have a look? Sure. So we go into the apartment and we have wardrobes with the Haverly pull-down systems in them. So I opened up one of the wardrobes. I turned around and I said, girls, hand up all those staff who hang their underwear on coat hangers in wardrobes. Oh, funny, none of you? Why is that? Oh, we put it in the drawers. There are drawers here. Don't hang them up, put them in the drawers. And I said, and how many of you are married? Half of them put up their hand. Do you have a wardrobe? And your husband have a wardrobe? Yes. Well, why have you got all the men's shirts and the women's shirts in one and all the men's and the women's underwear in another? Make it like a home. And it was like this light bulb going on. So I guess one of the salient lessons for me as a CEO that I should have learned many years ago, and I continue to learn, is never assume that your staff know exactly what you're thinking. Even if they should know exactly what you're thinking. But yeah, no, it's my baby. I have another baby that I can't actually talk about. It's quite controversial. It's been approved by the Commonwealth Government, and by the time I get back I should know what funding is attached to it. And I would be hoping, it's a model of service delivery, and I'm hoping that by the time we get to Errata and I create next year, it's going to be set up as a pilot. We can report back on the pilot.
Thank you.
So, any other questions? I like questions. But we're happy for any dialogue, any talking. We're just down the end of an email address, website or telephone, so please stay in touch. And for the speech pathologists, our client services manager is a speech pathologist and she loves talking to speechies. So Davinda can perhaps pass your details on to me and I'll pass them on to Harriet. Her name is Harriet Corner. Good, thank you.
Thank you.
It's nice to be asked.
Okay, thank you everyone, and thank you Robyn. She actually volunteered to do it. And it's lovely to have you. We are having a Hari Raya feast in a while. So you can join us.
Oh goodness, thank you, that would be lovely.